Well, vaping has become a public health crisis. Now, over the past year, the number of kids who are vaping has gone up by 78%. In fact, 1 in 4 high school seniors admit to vaping this year. And just last month, Michigan reported its first vaping death. Care of Southeastern Michigan is hosting a town hall discussion next Tuesday that's free and open to the public. And we're joined now by the president and CEO of Care of Southeastern Michigan, Monique Stanton. Monique, thank you so much for joining us. So tell us a little bit about what you guys are doing, because on the other side, advocates of vaping say, you know something, it's maybe not be perfect, but it's better than smoking, and it's an alternative. It'll help people quit.
Well, number one, nobody that is not smoking should ever start vaping, especially when we're talking about our kids. There's also a lot of research that's showing right now that people that use vaping as a way to stop smoking continue vaping for longer periods of time and often are actually end up smoking and using vape products at the same time. And the FDA has not approved vaping as an alternative or a smoking cessation program.
And so if they are using it as perhaps even a bridge to try to taper down their nicotine, doesn't clearly work.
There's a lot of mixed research around that particular issue right now.
So tell us a little bit about your town hall. What do you guys hope to accomplish with the discussion?
So we really want to have, an opportunity for youth to talk about what they've seen in their school. So we've got a couple kids that are on the panel that will be speaking. We also have a physician that will be speaking from Henry Ford about the specific health consequences, and somebody from the American Cancer Society. And our goal is to really be able to provide some good information to the public about what's happening, and specifically for parents and youth, an opportunity for them to ask questions and get more information.
Well, you know, when you look at things like tobacco, where there's nicotine and there's an addictive quality to tobacco, and it actually changes the brain. Do we know if vaping does anything to the brain?
Right, absolutely. So vaping often includes nicotine, and so when you're ingesting nicotine, especially when somebody's young, you're priming the brain at that stage, so they're more susceptible for later addictions in life. And so when kids start using nicotine products early, they typically become lifelong users, and that's what we really want to stop and prevent, is a whole another generation of kids that right now would say, yeah, I would never smoke, but they're open to vaping. We don't want to be introducing this topic or this matter to their brain and to their body.
And if we're looking at lifelong users, do we have any idea what some of the long-term impacts of vaping will be?
It's really mixed right now. So we know that over 400,000 people die a year from smoking-related illnesses. We also know that people that start to vape also have a higher likelihood of using other tobacco-type products. So what we're doing is we're creating a new generation of nicotine users, and there's a lot of serious health consequences. We've seen deaths, we've seen increases in hospitalization, and kids just struggling with impact on their lungs.
Well, there is the information for the town hall. We have it up on the screen now. It's this Tuesday, November 12th, from 7 to 8 p.m. at Macomb County Community College South Campus there on 12 Mile. And if they want more information, they can find it at Care of SEM.
Care of SEM, or on our Facebook page.
Thank you very much, Monique. Appreciate it.